even for the cell, cancer, any other cells which doctors thinks I need to test. So they use that one to check information about cancer, whether it's a benign or is cancerous. If it is cancerous, how aggressive it is. What is stage 4, stage 1, stage 2, stage 3 or 4, and what kind of, depending upon the condition or stage, doctors can decide what type of treatment they will do so that it may respond, or there is no need of treatment, is the benign, or there is no response to treatment at some stage. Okay, there is no treatment options anymore. Even we do, nothing can be done. It may be worse sometimes. So that is the importance of the tumor markers. So we have two types of tumor markers. When a cancer cell, the whites come from the malignancy, what, when a normal cell is transformed to a malignant cell, means it is doing unruling division of the cells. That is called the malignant cells. And malignant cells cause the malignancy or cancer. And that cancer, malignancy is cancer, and that cancer spreads. Cancerous cells, when it's malignant, it spreads throughout the body wherever it spreads. So it said when a normal cell is transformed into a malignant cell, it demonstrates when it transferred in the malignant cell, there should be some criteria, characteristics of the cell. Why is it different from the normal cells? Then it demonstrates or it develops or we have and some unique antigens. You guys know now what is unique antigens means. There are some proteins, specific proteins which present on the cell surface, right? Which not present in the normal cell. So it transforms from a cell, it change to a malignant cell when they develop some unique antigens on their cell surface. Or some cells produce some enzymes or hormone. So there are two types. One develops some antigens on their cell surface, or some malignant cells or cancerous cells, they produce some specific type of enzymes or hormones which we can found in blood, urine, stool, and any other body fluids. So that's why there are two types of tumor markers. It's a circulating tumor markers, the which produce the enzymes or hormone from the malignant cell, which we can get from the blood, urine, or any body fluid. And another is tumor tissue specific markers. That means which is present on the cell surface as an antigen. We have to detect both of them. We cannot just take the body fluid. So that's why you need the biopsy to take the tissue to check. In addition, your blood test. Clear? Okay. So what we use the Newborn markers, we just tell diagnose, stage, and classify cancer, estimate presence prognosis, and select appropriate treatment. That we already told that one. So measuring markers, what they does, throughout the treatment can give an indication to the physician how well the treatment is working or is not working, or what is going to be the dose, monitoring, everything. What are the different testing methods? Quantitative measurements in the body fluids using biochemical testing. There are different biochemical testing methods. There are the markers which flows. So you can do the either body fluids, immunohistochemistry testing. Immunohistochemistry means they are taking the biopsy. They are taking the tissue. They are going to make thin sections. Then they are going to label the tissue or stain the tissue with the antibody. Antigen is there on the surface of the malignant cell. They have the specific antibody and they stain it. Then they change the either by the color development or there are different techniques. Okay, so or immunohistochemistry studying. Histo means cell or tissue. So they are doing the different sectioning, take the tissue, then they process it. You are going to learn it in the next histology section. Okay, so not after the urine, how they section it or something. And then they the immunohistochemistry studying. They labeled that we have learned for the immunohistochemistry, the antibody they are using to detect the specific, say for example, PSA, prostate cancer. They took the prostate tissue, they slide it, then the prostate specific antigen, they already have some. Say for example, it is not a tissue specific, but I'm just giving an example. Estrogen, estrogen receptor is more specific. Okay, so estrogen, for say for estrogen, they are like to treat if there is any problem in the estrogen. So they are going to take the tissue, they will slice it in the thin slice. Then on the cell surface of the malignant one, they have the antigen for the estrogen. They are going to use some antibody which is specific. And when they put that antibody from the outside, what is going to, that specific antibody is going to bind with that cancerous antigen present in the cell surface. And this second antibody is tagged. We have learned when we have learned the different techniques. This second antibody is tagged with some chemical, alkaline phosphatase, horseridine peroxidase, we just talked. So then they can develop the color to see what is the intensity or if there is a presence of any cancerous cell antigen. So that's why they detect the immunohistochemistry using the immunological techniques and taking the tissue slices, they measure the presence or intensity of the tumor markers using the mainly the biopsy method. And also there are a lot of nowadays molecular testings. They can do the PCR and other things. There are a lot of molecular testings. I am not going to detail on the molecular testing. So now these are the examples of the circulating tumor markers. That means these markers are released from the cancer cell in any of the body fluids. Is the blood or urine or any body fluid anywhere. What are that? Calcitonin. Why this marker is used? Measured in blood for medullary thyroid cancer. Calcitonin. CA25. This is the ovarian cancer marker. You can be tested in blood. Beta 2 macroglobulin. It can be measured in blood, urine, CSF for multiple myeloma. Means different types of. It doesn't know where the cause first, the cancer. PSA is prostate specific antigen for prostate cancer. It can be done blood in men. AFP, alpha fetoprotein. It can be diagnosed, seen in liver, testicular, and ovarian cancer. It can be used for anything. Mainly they use the liver. Is very because testicular they can do the PSA in addition. Ovarian cancer they can do the C25, C125. But if you rule out only the liver, so when if they will have to catch whether it's a liver cancer or something, they are going to order 3 of them maybe. CA25, PSA, if it is a male, and if it is a female, only they are going to order CA25 and AFP. If it is a male, they can order PSA and AFP. So if the PSA is negative, that means it has been damaged the liver. Same kind of female, if it is CA25 is negative, that is the liver problem. If both are positive, means cancer is spread in both places. And CEA, it's carcinoembryonic antigen. It's colorectal cancer in the dialysis system. CEA. When you have suspected any colorectal cancer, they generally use the test for CEA. Guys, you have to remember, especially couple of them, calcitonin, CA125, PSA, PCEA. You have to remember which is responsible for which cancer, okay? So this is interesting to know also. I know you guys will do that. And now the tissue, where the antigens are present on the tissue, on the cell surface. What are those? Estrogen receptor, progesterone receptor, some HER2 new. This is also breast cancer marker, HER2 new. This comes very often. Nowadays is HER2 new. I just remember by the name HER2 new, but HER doesn't mean it's female. What is the name? HER. This is also you have to remember. HER stands for human epidermal growth factor receptor. This questions comes also. What HER means, stands for. Human, they may give you different options or they may ask you to type the things. So just make sure this HER is human epidermal growth factor receptor. So basically tissue specific markers are mainly estrogen receptor, progesterone receptor, and some FGFR3. This is identified for the bladder cancer. Okay, urinary bladder cancer. FG is gene mutation. It done by gene mutation analysis, but it is the marker is FGFR3. So here is the different tumor markers, which is marker who is specific for what? For the lung cancer, they do CA25, CEA. For breast cancer, they can do CA125, CEA, HER2. Liver cancer, mainly AFP, alpha fetoprotein. Stomach cancer, that is the colorectal one, CEA. Colon ulcer also. So anything related to the digestive system, they does the CEA. Prostate, PSA, pancreatic, it can be CA125 and CEA, testicular, alpha fetoprotein, HCG, ovarian cancer, CA125 CEA, for breast cancer, HER2 new. So there are HER2 new, yep. So this is the chart. This is interesting chart. This is also good for us to know. Okay, so tumor markers, some of these could be elevated due to benign condition also and may not be definitive test. Further testing may be required. So what happened? Maybe in the benign condition, some markers may be elevated, but it's a benign. Or you are going to think you are going to have cancer, cancer, cancer. No, doctor has to go through all the clinical testing, all the manifestations the patient has, and then they will take the decision. So physicians are also trained to take this laboratory result and use them to look at the whole clinical picture. Questions? Yes, no?
No, ma'am, I'm okay.
No, ma'am. Thank you.
Okay, okay,
No, thank you.
okay, no problem. Let me see what about this is the interesting one. I like that. How many we just read the tumor things I feel is more interesting. Okay, so let me go to the team. What is there? Not team, what is called? Clean chemistry, hematology. We did hematology, right? Clean chemistry. See how much we learned. We are at 43%. I don't know what we are going to learn then in 1 week. Where are in the units? We are in unit 4. We did so the unit 5, right? Endocrine system tumor markers. Okay. Now they want me to show you video. You show the video, then we'll go to the other side.
Over the course of our lifetimes, our bodies undergo a series of extraordinary metamorphoses. We grow, experience puberty, and many of us reproduce. Behind the scenes, the endocrine system works constantly to orchestrate these changes. Alongside growth and sexual maturity, this system regulates everything from your sleep to the rhythm of your beating heart, exerting its influence over each and every one of your cells. The endocrine system relies on interactions between three features to do its job: glands, hormones, and trillions of cell receptors. Firstly, there are several hormone-producing glands, 3 in your brain and 7 in the rest of your body. Each is surrounded by a network of blood vessels, from which they extract ingredients to manufacture dozens of hormones. Those hormones are then pumped out in tiny amounts, usually into the bloodstream. From there, each hormone needs to locate a set of target cells in order to bring about a specific change. To find its targets, it's helped along by receptors, which are special proteins inside or on the cell's surface. Those receptors recognize specific hormones as they waft by and bind to them. When this happens, that hormone receptor combination triggers a range of effects that either increase or decrease specific processes inside the cell to change the way that cell behaves. By exposing millions of cells at a time to hormones in carefully regulated quantities, the endocrine system drives large-scale changes across the body. Take, for instance, the thyroid and the two hormones it produces, triiodothyronine and thyroxine. These hormones travel to most of the body's cells, where they influence how quickly those cells use energy and how rapidly they work. In turn, that regulates everything from breathing rate to heartbeat, body temperature, and digestion. Hormones also have some of their most visible and familiar effects during puberty. In men, puberty begins when the testes start secreting testosterone. That triggers the gradual development of the sexual organs, makes facial hair sprout, and causes the voice to deepen and height to increase. In women, estrogen secreted from the ovaries signals the start of adulthood. It helps the body develop, makes the hips widen, and thickens the womb's lining, preparing the body for menstruation or pregnancy. An enduring misconception around the endocrine system is that there are exclusively male and female hormones. In fact, men and women have estrogen and testosterone, just in different amounts. Both hormones play a role in pregnancy as well, alongside more than 10 other hormones that ensure the growth of the fetus, enable birth, and help the mother feed her child. Such periods of hormonal change are also associated with fluctuations in mood. That's because hormones can influence the production of certain chemicals in the brain, like serotonin. When chemical levels shift, they may cause changes in mood as well. But that's not to say that hormones have unlimited power over us. They're frequently viewed as the main drivers of our behavior, making us slaves to their effects, especially during puberty. But research shows that our behavior is collectively shaped by a variety of influences, including the brain and its neurotransmitters, our hormones, and various social factors. The primary function of the endocrine system is to regulate our bodily processes, not control us. Sometimes disease, stress, and even diet can disrupt that regulatory function, however, altering the quantity of hormones that glands secrete or changing the way that cells respond. Diabetes is one of the most common hormonal disorders, occurring when the pancreas secretes too little insulin, a hormone that manages blood sugar levels, and hypo and hyperthyroidism occur when the thyroid gland makes too little or too much thyroid hormone. When there's too little thyroid hormone, that results in a slowed heart rate, fatigue, and depression. And when there's too much thyroid hormone, weight loss, sleeplessness, and irritability. But most of the time, the endocrine system manages to keep our bodies in a state of balance. And through its constant regulation, it drives the changes that ultimately help us become who we are. If you want to learn more about the ins and outs of the human body, start with this playlist, or subscribe to our channel to keep your finger on the pulse.
Nice video, easy. So this is the life lab things. So you can go through this one And this is your job to look at this. And yeah, what is the treatment for hypothyroidism acquisition, how it comes. So you guys going to look at that one, live labs. So this is, you have to do that. There's nothing to teach in the class. And this is also detailed study if you want to do. This is from the National Cancer Institute. That is for your knowledge if you are really interested. Yeah, so you can the different stages of cancer, what is the prognosis, what does you mean the liquid biopsy, different type of targeted therapy. So it's a huge knowledge about the cancer. Sometimes it's nice to read for our own knowledge, especially when cancer is taking over us, everything. So this one, next one is, we are going to unit 6 now. Okay. So unit 6, we are going to talk about therapeutic drug monitoring and drug abuse. So I'm not going to go through all these things. You guys know what is the property of Anderson College, what the, you can see the things, you have everything in your D12. So let us go a little bit. What therapeutic drug monitoring means? You already know, we have discussed some of them. So therapeutic means the drugs which are using for the treatment of a patient. So considered a time test in the laboratory. What it does in this process, the concentration of chemical substance is administered therapeutically as per doctor's prescription. And then they identify to measure the peak and trough. That means high and low levels. These two terminologies important. Peak and trough. TROEG trough. Okay. They like to see what is the peak level and what is the trough level. They are going to do, it's a time based, maybe you take the medication, or before taking the medication is the doctor is going to say how to do that. Before taking the medication, maybe one test, then you are going to do probably 1 hour, what is the, depending about the what drug is using. Okay, so then maybe 1 hour or 30 minutes or 2 hours, then they are going to do maybe another 2 hours or 4 hours to see what is the peak value and what is the is getting low. So maybe these drugs should be act within 15 minutes or 20 minutes or an hour, but in your blood test is not showing that, it is maybe showing before or after. So that's why doctors can understand how to do the treatment. So that's why it says this determines the dosage level and intervals of drugs needed to keep the patient in therapeutic range. Is it clear what I told you? So that the drugs are not too high, which cause toxicity, or not too low, that not being effective. So you have to drug the therapeutic diet in such a level, in a dose, so that it should not be toxic, or it's not like it's not working, like the blood pressure medication. When you have that, they will start from the low dose, it doesn't work, it's going to, blood pressure medication is so common nowadays that just go little bit, they increasing or decreasing the store. But there are couple of drugs which needs to be treated for the digitoxin, for the heart things. But what dose actually you are going to do? If you use too much digitoxin, the heart may stop, or it may too much activated. If it is too low, it's not going to function, just for example. So TDM testing is used only for few drugs, not all, which is not basically have a huge life-threatening things, I should say. So mainly therapeutic drug monitoring test is used to know the therapeutic range. What is the range from this dose to that dose the doctor can order, so that the drugs are not to be high cause toxicity or not too low, so they are not effective. So it's used for only couple of few drugs. What is peak and trough? The peak indicates the highest level of concentration of a drug. So, say for example, sample collected 0.2 to 2 hours after the dose is given. So, peak should be in this range. That is the highest level of concentration. That is called peak. Peak means highest level of concentration. And trough, it is indicates the lowest concentration. That is blood collected just prior to the next dose. Say for example, you have to take one medication now after 4 hours or 6 hours. So when you are taking the blood to do the analysis just before, that is basically considered as the 0 hour, where there will be lowest concentration. Okay, so trough indicates the lowest concentration of the therapeutic drug, and it generally takes sample is collected just prior to the next dose. And peak is where the sample is collected 0.5 to 2 hours after the dose given, depending upon the which drug doctors was to test, and it is going to be written in the requisition. Collection time are dependent on the drugs being monitored. See what I told you? So what you are going to collect, especially for the peak or for the trough, it depends upon how the drug is monitoring. Drug is monitoring 4 hours, 6 hours, 8 hours, twice a day. So it depends upon when is before you are, say for example, you have taken the drug 8 p.m. In the morning 8 a.m. you are going to take the another medication. So before that, when you are taking the blood for checking the TDM, that is the your trough. Now the doctor will tell, say for example, you take the medication and doctor will tell, depending upon the which drug they want to test, whether you have to collect the sample at 0.5 hours or 1 hours or 2 hours, depending upon the drugs, to check the peak level. That's why they say when the physicians order TDM testing, they will indicate the time want the collection to occur. If you doesn't see that one, you cannot do the TDM testing. And the collector should aim for this time as close as possible, because it's a time dependent. If it is for the window, if the doctor said you have to collect it 1 hour, you have to be plus minus 1 hour, probably 10 minutes, not more than that. Because maybe the drugs is going to start decaying. So this is the peak and trough is called. So this is the dose administered. So here is called the, is going up, is going to the peak value, and then is coming down here. So here is the lowest concentration. Here or here is going to be the lowest concentration. So doctor will tell you if the drug needs to be monitored again. So you have to, doctor will tell when you have to collect the blood, because if the another dose is started in this time, so it's going to overlap. So where you can get the lowest level. So this is doctors has to do that. But how the peak level and the trough level? Trough is the lowest concentration where the time we are get, and peak level is where we get the highest value. Trough level is generally before starting the next dose. So initially a greater part of the drug is absorbed, then is distributed, metabolized and eliminated. Basically that's why it takes a time to get in the blood. First you are taking the drug, either is going to, then is going to be absorbed through your body, then is going to metabolize, because we are, if you are, say for example, you are any drugs, it's not going to come as the same drug in your blood, because it can to be break down. It's called the metabolist. So it is going to be metabolized and then it's going to be eliminated. So concentration of drug oscillates with each dose, the goal to achieve the therapeutic name range. Examples of therapeutic drugs, couple of examples, what they use for the monitoring. Okay, so it's too much 40. Some antibiotics, gentamicin, vancomycin. You have to remember because they are going to ask some questions. Which drug is under the give? They will give lot of things, permutation, combination, and then which is not therapeutic drugs or which one is the therapeutic drugs. Okay, antibiotics under antibiotics, gentamicin, vancomycin, tobramycin, amikacin. I didn't hear about the amikacin. Anticonvulsing drugs, carbamazepine, phenobarbiturate, cardiac digoxin or digoxin. Somebody calls digoxin, somebody calls digoxin. Respiratory, theophylline, antidepressant, amitriptyline, etc. Mood stabilizer, lithium. Some are more acetophenone, phenytoin, salicylate, valproic acid. Okay, so those are different examples of therapeutic drugs which is getting measured. Okay.
Didn't say anything about like diabetic for blood sugar, like
Yeah,
insulin, metformin.
it's not, maybe I don't know. Let us see whether they have. Yeah, metformin is okay.
Yeah, metformin's pretty safe, but like when you like go
Pretty
to
safe.
insulin,
Insulin, they does the dose monitor, yes, but they doesn't probably doesn't check the the blood level. They just take the blood glucose.
okay.
That's why take the only the blood glucose because they can state directly. It doesn't need to be metabolized. We can just immediately check the blood glucose level, by either by POCT testing or anything. So you can just monitor that one. But this one needs to be collected in the blood and then have to test it directly in the lab. You cannot do the POCT testing for this one. Whatever my understanding. So now there are different collection. What is the digoxin used for congestive heart failure? So always blood collected next to dose for the throat level and for the minimum 6 hours. See this one for 6 hours. On a minimum of 6 hours since the last dose. That is going to give you the peak. So each drug is different. Okay, so give me a one second. Okay. Okay. So collection and handling. So digoxin is used for congestive heart failure. Blood collected prior to next dose for the throat level, as for everything. For peak level for digoxin, you have to collect close to 6 hours. Always record the collection date and time since the last dose. You have to always remember the date and time. What time and which date? What is the last dose? That you have to ask the patient when you're taking the last dose. And then you have to write the date and time. Collection date and time. First of all, the last dose has been taken and what time you have collected, obviously, and the collection date. Patient instructions for digoxin collection: you collect for the SST tube, store and ship refrigerated. Red top tubes are acceptable for analysis, and this is the reference value. It doesn't remember the reference value for digoxin. So vancomycin, through specimen, collect prior to next dose, everything, record collection date, time, red top tube, clot for 60 minutes for the red top tubes, centrifuge and aliquot, no SST tubes for vancomycin. So that means you cannot use the gel separator, vancomycin. Okay. Okay. So reach if testing is delayed more than 72 hours. Salicylate, same for example, for trot level, next to dose. For peak level, doctor is going to write in the rest requisition. Color preference, rate of tube, clot for 60 minutes, centrifuge and aliquot, reference value. So vancomycin, salicylate, you have to collect, you can collect in the red top tube. But for the vancomycin, no matter what, we cannot use any gel separated tube. So you have to use the red top tubes. What is critical values? Critical values, all TDM will have critical high levels, as this is when a therapeutic dose is no longer effective but toxic. All critical values need to be called to the physician or nurse immediately and then documented in the laboratory information system. Any critical value which is above the normal is going to be the which is patient can be at risk, or the body what is not monitoring. So it said the all TDM will have critical high values when the therapeutic drug is no longer effective. Either it is going to be as so high that it is not effective anymore. Rather, it may cause some little bit threat. Okay. So what is next one? Drugs of abuse. Okay. So what is the drugs of abuse? So drugs of abuse means which is not prescription or illegal drugs that are present in the urine or bloodstream. Drugs of abuse are prescription. Sometimes it's prescription is like the marijuana and other things there, but how much they are taking, or illegal drugs that are present in the urine or bloodstream. What are those? Marijuana, cocaine, opiates, methamphetamine, benzodiazepine, barbiturates, methadone, oxycodone, ecstasy, and more. This purpose is they can ask for test for illegal or prescription drugs levels done on unconscious individual who present to the emergency department. We just know sometimes, right? Sometimes they come over drug abuse, especially there is a history, we can see it. Done on patient who have been motor vehicle accident in case they are driving under influence. Any motor vehicle accident comes, we have to do the drug monitoring test. May be used for medical legal purposes. Test values be used for the court or law. This may affect specimen retention. Retention means to keep the samples. So it's called the medical legal purpose when it needs to be for the court or law, some legal issues. So in general, if the doctors want to test something, in general, the test is fine, but mainly with the unconscious patient, we don't know whether there's alcohol abuse or the marijuana abuse or overdose. A lot of patients come overdose and they are unconscious. So you have to do the drug monitoring. The motor vehicle accident for sure, even it's not influenced by drug or something, you have to do the test. You never know whether it is if they were driving under the influence of any drug. So the purpose is to test the illegal or prescription drugs level done on unconscious individuals. done on patients who have been motor vehicle accident, used for medical legal purposes. Okay, good. So testing examples. Drug of drug of abuse screening test of blood and urine specimen, they are going to give it. So they are taken from the Live Labs Ontario test directory. You can go there. They have the all details. You can see there from the your D12 and you can check. So these tests and their collection techniques may vary lab to lab. So ensure you are aware of what your lab requires for the collection and special handling of drugs of abuse testing. Remember, Life Labs is based on the specimen collection center, whereas a hospital will have an emergency room where patients come when is needed, have experienced trauma. So hospital is immediately testing it. What is having experienced trauma? But Life Lab, they are collecting mainly in the collecting centers. Collect minimum 10 ml of random urine for urine. Urine collection may need to be monitored by healthcare worker because you doesn't know who is doing what. Maybe you know somebody has been caught for the drug abuse by the police, bring it to the hospital or somewhere they are, need that. So what? They go into the washroom, they can dilute the sample. There are the procedures how you're going to monitor. You are not going to go inside with the patient or the who needs to be done the drug testing, but you have to make sure with all the things, all the precautions that they cannot dilute the urine or ruin the sample. So collect minimum 10 ml of random urine. Urine collection may need to be monitored by healthcare or worker. Okay. Transfer 2 ml urine to 6 ml vacuum aliquot top. Nowadays, we don't have it in there, but nowadays you have a vacuum aliquot tube, 2 ml urine, store and ship refrigerated at 2 to 8 degrees centigrade. So you need transfer 2 ml to a 6 ml tube and then store and ship refrigerated at 2 to 8 degrees centigrade. One apple sample is acceptable for hard to collect. If there is ready, then you have to write in the list that sample is very hard to collect, so you get only 1 ml sample. That is the step you have to write it. Otherwise, the sample is going to be rejected. So, additional information, what type of drugs can be included? Amphetamines, benzodiazepines, buprenorphine, cocaine metabolites, fentanyl, oxycodone, opiates, cannabinoids, THC. For the collect plain reed top tubes for the drug abuse. Do not use an alcohol swab to clean an arm for correction. Why? Anyone can answer? For any drug abuse?
It will interfere, ma'am, with the result because of the
Yeah,
alcohol.
yeah. If you are asking for the alcohol concentration,
Yeah. Yes, ma'am.
is going to affect. So, what you have to use that time? What type of
Iodine or
fluorohexidine
chlorhexidine. Yes.
Chlorhexidine.
or iodine? Okay. Iodine sometimes gives color, so generally prefer to use the chlorohexidine. Okay. So it can clot for 30 minutes and centrifuge, transfer liquid. This is regular use, 2 to 8 degrees centigrade. So these are the different drugs you can collect blood for doing the testing. As they are drugs of abuse and not prescribed, typically the reference range in health adult is 0 because you doesn't know, right? The reference range for them. If any amount come which should not be in your blood, that is you are giving the result you have some in your body. When this is illegal, medical legal testing. Medical legal testing is also available for DOA and will be collected following strict protocol and will be chain of custody form follows the specimen. What is the chain of custody form? It tracks all the people who handle and collected the specimen between the time is collected and analyzed. This is chain of custody. If a screen is not required and the drug of abuse is suspected, the physician can order specific drug testing later. Okay? Good.
Yes. Ma'am, what about the hair strands? We've been hearing that also that they can also test that for drug abuse.
Really, we don't do it in the hospital. I have no idea about that. Really?
Yes, ma'am, the hair strand, but I don't know how they test in the lab.
Yeah, hair follicles can tell
Hair
like
follicles.
months
Maybe,
and
maybe,
months.
maybe they can take the hair follicles, but it's going to be going to be very less. But anyway, they can take the hair for not the hair. Maybe actually the hair follicles live things, right? They may extract from there and then test it.
Mhm.
Let us do the search then.
Okay,
When you
thank
bring
you.
the attention. What is called hair?
Follicle or strand.
As
Testing for illegal drugs.
hair follicle drug testing uses a hair sample to identify drugs in person's body. It is a newer testing method favored by the court system, okay, and employers. Oh, okay. Hair follicle drug test can be detect drug metabolites, which are the byproducts from when the drugs are in your system. The state requires a minimum hair sample of 1.5 inches from the head. Oh, I
Mhm.
didn't need that. Oh, that's good. Thanks for letting me know. So you
You're
have to take the
welcome.
follicle. Yeah, yeah.
Yeah.
Hair follicle test can detect drugs of use up to 3 months before testing. Using hair samples that come, even you wash the hair, it goes. Using
It
hair
stays like
samples
right
that
in
come.
your DNA.
Yes, ma'am.
Like it
Possible.
stays right in for months.
Okay, using
Mm,
hair
hair
samples. See, it says
sample.
3 months.
Yeah.
Using hair samples that come from a person's scalp, urine tests can detect more recent drug use.
Yes,
Yeah,
because
urine
some people
immediately.
will
Yeah.
they'll stop doing cocaine or crack like 2-3 days before a drug screen and they'll be clean. But if you test the hair follicle, you can't hide it.
Aha, see? As they are hiding, researchers are being more proactive to find it. What is how they can do it?
They're one step ahead.
The frequency of drug use does not
Advance.
impact test result. It is
Yes.
the period in which the user used drugs that determines the outcome of the hair follicle drug test. Whether the person used once or 50 times a 3 months period. The hair follicle drugs will indicate what is the principle. Let me see the principle, how it works. Tests involve removing small laboratory testing. Result can show a person has been using certain drugs. Patterns of illicit drugs used for prescription medication, misuse over a certain period, typically 3 months. So these are the economies of everything. May need to undergo drug testing for employment, legal or medical purposes. Okay, so maybe have to the employment and legal purposes, they can just do the blood test. It's not going to go that what Kara told. They're stopping the taking drugs, but they are addicted. Wow. A hair follicle drug test can take place in a healthcare setting or laboratory workplace. During the test, the tester will remove a small hair sample close to the person's scalp and send it to laboratory for overnight testing. Such prescription medications and certain foods such as poppy seed may contain compounds that we eat poppy seed lot, so I cannot do that. May contain compounds that is cooked,
not I just take it as a drug. May contain compounds might lead to false positive results. Okay, so first step involves an enzyme-linked immunoELISA, which is a rapid screening method. Okay, so it is a positive result, particular so technician receive the same confirmatory chromatographic testing, such as mass chromatography. Collect the hair sample according to manufacturer direction. Wrap the hair sample in a piece of foil. Place the foil wrapped hair in the provided envelope. Mail the envelope to the laboratory. Negative result means not detected. Positive. How accurate the hair follicle drugs determine whether the person has been using certain substances within the past 3 months. However, they cannot pinpoint the exact date of drug use because hair growth rates can vary widely among different people. Okay, so but I have to know how they do the cost of hair follicle tests. There is a range who can purchase the kits either directly. $100. 12 different drugs is $100. Okay. What is the person has no hair on their head? Ho ho. Hair samples who is bald can
I don't think
come
it has to
from
come from the top of their head.
hair samples can come from armpit or face.
Yes.
So people can do. That's nice. Okay. Wow. Hair follicle test by urine test. I didn't know that. Thank you so much, guys. Thank you. Hair follicle test can provide a much larger window for detection than urine test. Okay.
It's
But
good
now I
to
have
know.
Yes.
Yeah.
Yeah.
See, that's why it's so learning is vice versa. It's not like that I know everything. Oh my God. Oh my God. It's so interesting. Shh. This is a new thing. I never knew that. Thank you.
You're welcome, Mom. Thank you also. So it's ELISA. I've been the testing in the lab is through the ELISA principle.
Yeah, I say ELISA. I saw you say ELISA. And then they do the mass testing. If ELISA is positive, then they do the mass testing.
Right.
Gas spectrophoty or yeah, GM. Okay. Okay. Very good. Very good. Very good. Woohoo! I'm so happy. Okay, let us go to our unit. Okay. Okay, so we did the therapeutic monitoring. So what is the collection of this toxin? Do you want to see the is a video or something? Or you did it? We did it, I don't know. Login. So it is not allowing me to log in. You guys made able to log in. Okay. This next one. Chain of custody. We already did that. Chain of custody means you have to check in every point. The chain of custody process protects both person having the test and the employer or caseworker. A form of legal safeguard since it may be challenged in courts. The chain of custody forms documents the proper transfer of specimen from the time of collection to the processing at the laboratory. So this we did. Okay, so next one. Now going to the point of care setting, unit 7. That is the last one?
I think so, Mom. Yes.
How many slides are there? Oof. If I can download it, it's not allowing me to download yesterday. Oh, today it did. Oh, yesterday it was not allowing me. Okay, good. Copyright information. How I can download this? How you guys download it?
Did you scroll this down in the end?
At the end?
Yeah.
Okay.
Yeah.
Oh,
Here is
okay, okay, okay. Binas, you did good also. You are happy?
Yeah.
Yeah? So you like my
Yes.
class? You like my
Yes.
class?
Yes, ma'am.
Okay. I'm going to send Badil that Binas did so good.
Thank you.
Welcome. Okay, so now
let me see how many slides are there. 59 slides. You guys want to take a break and start this one, or do you want to continue and then we'll take a break a little bit later? Let me. What you guys want to do?
Can we go for break, ma'am?
Okay, so do it. Then we are
Yes.
going to do this one. Okay. Okay.
Yes.
Good.
Thank
Okay.
you.
Okay.
Thank you,
Okay.
Miss.
Okay. Okay.
Thank you, Miss.
Okay, dear. When is opportunity, I can. Whenever I remember, I become so much stressed with all this, how I'm going to complete, how I'm going to, not only I'm complete, I can go running like a horse, but I have to make sure that you guys understand, right? It's too much. So that's why I have to think about that. Yeah. Okay.
Thanks, ma'am.
Yeah.
এটা কি এসেছে? এটা আমার জেমও এসেছে। তার Are you guys back?
Yes, ma'am.
Yes, ma'am.
Okay. Okay.
Yes,
So
ma'am. Here now.
we can stand, right? Okay. Okay.
Yes, ma'am.
So okay. Okay. So just let me do the attendance and then I will be there with you. Okay. Attendance is already done, but I just document it here. Inbox. সিয়া তুই কিন্তু বাথরুমের দরজা বন্ধ করে দিয়ে যাবি।
Guys, I wanted to know, did you guys manage to download the PDF for the slides?
Sorry, Shabana, which PDF?
I was trying to download the slides like for unit 1, 2, 3 and stuff, like all the highlighted ones to study.
Oh, okay.
But I couldn't download them. It kept giving me an internal error. But
Okay,
I
let
just
me
wanted to know if any of you guys got the same issue or not, or is it just my laptop?
let me try because I haven't tried it yet.
Like I'll download it and then it would just go to eternal error. It would say it's downloading and then eternal error would show up. That's it. Because I wanted to take all of the highlighted ones and like make it into one PDF for like notes, but I couldn't do that.
Actually, for me, it's okay. I'm just reading it through D2L. I'm not downloading it. Yeah.
And I usually just print it because when I go to my kids' stuff and like when I'm running appointments, I just read it during then.
Yeah, I'm just reading it through D2L.
I find it so hard to read it on the phone if I'm outside or like if I have like some time. It's so small.
Very difficult in the
Yeah.
phone. Yeah.
Shabana, I was able to download it. It didn't give me any error.
Oh, okay. I think it might be my PDF then. I might have to
Yeah,
update my
maybe.
PDF version because it was very distorted too. So I was just wondering, like, what is it? First, it was very distorted, then it just kept giving me like internal error. But let me try a few things and see. Thank you, Christian.
No problem.
Appreciate it. Are we gonna have lab on Tuesday, or are we gonna have the day to do our presentation?
You have to be on the lab.
assignment.
You have to be in the lab. You have to
No,
be in the
I
lab
mean,
and
yes, we'll be in the lab, but can we will we have time during the lab to do our assignment, or are we gonna be practicing like
you have to
lab work?
practice. You guys can, if you want, you guys can bring your laptop, but you have to complete whatever you did into the formative parts.
Okay.
You guys are lagging behind, so you have to check that your formative parts is done, everything is filled up, then you did the summative for everything. For till today we are doing the clinical chemistry. You didn't do it till now. There is nothing too much to do in the lab to do something like the pH meter and other things. Whatever you did, whether you have filled up your skill books and everything is ready, summative plus formative.
Okay, ma'am.
Okay.
Thank
In
you.
addition,
Yes.
if you guys have time, you can practice whatever you learned in the lesson for the phlebotomy serum just to refresh yourself. And rather other times you can do your work.
Okay,
Okay.
ma'am. Thank
Instead
you.
of talking or something, you guys can take exam for students if they cannot take it. Also, Monday you will have the time after the exam to do the the formative and summative. As to who is can complete it, you can do that. Wednesday I'll try to, because your assignment, you guys wanted one more times your assignment, I can accept it on Wednesday, but maybe I have to see how I can do the PowerPoint presentations. It is going to be in pair. So if it is a 10 minutes or 8 minutes presentation, two persons have to present, first and second. Okay, so it's not like that only one person is going to present. So there will be 10 presentation, each minimum 8 to 10 minutes, and in pair. So it's going to be 10 presentations. You guys can choose your partners, and yes, and both of you have to present. Okay.
Okay.
Yeah. So make the presentation ready and send it to my Outlook so that I can open it from my computer and you guys can talk, okay? Instead of bring your own computers. Unless you want to, but then it's going to problem of the connection, this and that.
Okay, thank you, Miss.
Yeah, okay.
Yes, thank you, ma'am.
Okay. Okay.
So ma'am, we're going to do the presentation in campus, right? Next
Yeah.
week.
Yeah.
Okay.
Yeah.
Okay, thank you.
Yeah, no problem. Just give me another second. Okay. Let us go to the point of care testing. And then probably we are going to be done. Okay. Yeah. So what is point of care testing means? We have discussed it before. What you mean by point of care testing?
Near the patient or at the bedside?
Yeah. At the bedside, near the patient, which is close to the near the patient, where it is located. Okay, where the patient is, the chair, on the bed, wherever is that, or patient is eating, is near the patient. That is the point of care testing. In the point, you are giving the care at the point where the patient is. Okay. This is useful for off-site laboratory testing, also known as near patient. The patient is at home, this patient cannot move, patient cannot go anywhere. So you can off-site laboratory testing. This is also called, it can be done off-site laboratory testing. Inside the laboratory is fine. POCT may offer the major advantage of reduced turnaround time of the test result, which can improve patient management. Right? Is you are getting the result immediate turnaround time. The major drawback is cost per test when compared with the lab testing. Other areas of concern include maintenance of quality control, quality assurance, proper integration of data, connectivity to the patient medical record. Because it's a handheld instrument, right? It's not connected with the LIS system. So you have to enter the data. And cost is more because it's per, you are taking this one and is per, for individual run, you are needing the one test strip or one qubit or whatever. So more cost effective. But advantage that you can go where even the remote access where the patient cannot come, or you can go there if the patient is not mobile. So you can go and do the testing and you can get the result immediate. You doesn't have to wait for the analyzer to load, give the results and other things. The drawback, cost, and obviously you can do the quality control, whatever the standards and other things, you have to do it, but it's not giving the quality assurance or the proper quality control. And obviously, the entering the data in the integration in the LI system. Point of care has a complexity range of complexity and procedures that vary from manual methodologies to automated analyzer. There is a huge difference. So devices are often called handheld or maybe small portable analyzer. These are more expensive than labs testing, but appropriate and cost effective in some clinical settings because testing is performed near the patient and informs immediately decision for clinical management of the patient. So the high blood sugar, instead of giving you, even in the hospital when the cups, you are going to take the blood, you are going to send it, is going to come back at 45 minutes, immediately say for the glucose, they did that near the point of care testing with the test strip, the glucose is 26 or 11 or 12, immediately doctor can take or the clinical management team can take the decision for the patient treatment. So though it's cost effective, but some clinical setting, it is very useful for the immediate decision making. Tests include glucose, urine dipsticks, blood gases, some chemistry, hematology, coagulation, cardiac markers, and pregnancy test. Do we only use the blood glucose and urine dipsticks? Basically, all other goes to the different labs. Okay, anyway, advantages and disadvantages. Advantages can be done bedside, reduce turnaround time for results, can improve time to treatment, good for remote locations, not near a lab. Cost, more costly. Non-lab workers POCT additional training, say for who is the midwife or some PSW, if they are doing it, not healthcare card is going, you need to give them proper training that you have to do the quality control, you have to do this, you have to do that, what is the actual SOPs, and you have to make sure they learn and follow the procedures. Quality assurance and control procedures may not be followed because it is not under the automatic analyzer or under the actual lab system. You doesn't know who is doing what. Not directly connected to the lease. Test complicity is determined by criteria that assess knowledge. Most users are not lab professional who are taking care of the home. Annual training or new user training. If you are using new kit or whoever is doing that, you have to give them the annual training. Reagent and material preparation, most POCT is very minimal training. Operational technique is very user friendly. QC needs to be followed and documented. Sometimes these analyzer are downloaded and stays in the doctor's office. Regularly scheduled maintenance, interpretation and judgment results are typically easy to read because it's coming in your handle analyzer. What do you find POC testing? What POC test would they be using? Is there any answer? Where would you find POC testing?
Sometimes in the emergency department, doctor's office, at the patient's home.
Mm-hmm.
Yeah.
And why you are doing the POC testing? To get the immediate instant result, less turnaround time, right? Okay.
Yeah, convenient too.
Okay. So what do you find POC testing? In people's home, as you told, glucose pregnancy mostly. Doctor's office, urinalysis pregnancy. Emergency department, troponin pregnancy. Troponin we doesn't do. We just rather it's not the, so also we do the glucose lot. Troponin it has to be the chemical analysis. Anyway, here the detail wrote, but I don't agree. So troponin pregnancy, but they miss the glucose. We do the glucose. Remote control, rural clinics, glucose, troponin, hemoglobin. Patient wards in hospital, glucose, troponin, hemoglobin. Canadian Blood Service, obviously hemoglobin, and maybe more. Where in the clinical laboratory, even though it is not done beside the patient, the lab still has the POC testing used for screening and rapid result. Sometimes, if it is immediate, less turnaround time. More often testing methods include benchtop, like the clinic test, pregnancy test. So they can be immediate. It's mainly follow the device solve immediate test. Some examples include urinalysis, the dipstick. You are going to do it in the lab. Infectious mononucleosis, generally we doesn't do that. RSV, chlamydia, fecal occult blood test, that is also done. And beta ECG for the pregnancy. These are the some fecal occult blood test. You have to do it by the strip. It's not immediate, but you can collect it from the home to check the blood or colorectal, any bleeding in your stomach by through the stool. So that is the fecal occult blood test. But it says even in the POCT, it says all laboratory testing must meet the same quality standard regardless where it is performed. For moderately complex POCT, in addition to the requirement listed for web test, instrument validation is required for each new instrument. When you are using the new instrument, it has to be validated by the lab or the organization, and they have to give you the training and you have to tell you the SOPs, how you are doing that. Written policies and procedures must be available the patient preparation that I told, specimen collection, preservation, instrument calibration, QC, remedial action. This is the all things under the, they have to give you the training when there is a new instrument has been introduced. The greatest source of error is pre-analytical for everything. Pre-analytical error, especially patient identification and specimen collection. We are hearing, listening this one since the probably after the ethics. We are doing the everything, not since from the ethics. Patient identification is the most important things. Even we are doing it, but till there is a chance anytime there is a problem in the patient identification, especially for the first list, last name, that is the most common. And then sometimes first name, last name, date of birth is same, then is another problem. Then you have to go to the health card number. So patient identification is very, very important. Role of the lab in the POCT. So depending on the laboratory setting, lab still plays a role. Sometimes a POCT technologist is hired to do the analysis. They will maintain oversight over the out of the POC analyzer. Who is going to monitor? Who is using POC analyzer? Whether there's a QC is doing properly, whether the workers who is doing the POC testing is following the rules, they are documenting, cleaning everything. So they are responsible for training non-lab staff on use, reviewing their maintenance and QC records. Sometimes you go for visit to check in with staff to ensure proper. That is a vigilance test. They go and just check whether the staff is doing properly or not. Use and care. We love to ensure lab testing is performed the lab way to ensure patient results are accurate. Okay, so types of point of care platform: strip-based called the rapid POCT, handheld POC analyzer, benchtop POC analyzer. Okay, so see, POCT non-instrument strip-based. You doesn't need any strip, just the strip, like the pregnancy, glucose, POCT, instrument-based testing. Non-instrument. POCT may be done by manual rapid test methods such as those for COVID-19. That is, you have the strip, right? The pregnancy. You doesn't need any instrument because it's the inbuilt control and test window. You put the urine or blood or serum or your saliva, anything, and it's going to run. And if there is that is the based on immunochromatography. And there is two windows. One is control and test. Control window is always giving you a band to make sure your test kit is working or not. And if you get another band here, that is the test window, then it's going to say, yeah, you are positive. So this is the COVID test. They have been developed for the rapid test, and pregnancy is always done. You have the SARS, this type of the pregnancy, non-pregnant, pregnant. When it's non-pregnant, there will be one bar. When there's a pregnant, there will be two for everything. Fecal all blood, infectious mononucleosis, RSV, but individual within the pregnancy kit, you cannot detect the COVID. So each one has their individual kit. Pregnancy test strip or the COVID test strip, SARS test strip, for each one, their test strips are different because each immunochromatography procedure is different. Each one has a different antigen, and they have to use the antibody raised in research lab to make sure that antibody is specifically bind to that one in the chromatography. It's a paper. Chromatography is a paper. It's a special type of paper. When you put some sample, it moves and then it does reaction. In these areas, there are the chemicals, antibody. When this is coming, antigen is coming through that one, is getting reacted here and giving you the results. So also known as called the rapid testing, required to run scheduled external controls, and each time a new kit is opened based on hours, every 8 hours. Ensure not expired and stored at recommended temperature. Has on internal control lines, what I told. If C line does not appear, test is invalid. That means the test strip is not working. Sometimes they make two different colors to make more nicer look. Sometimes maybe the same color, but you have to have two bands to have to appear for making sure the test is positive, any kind of test. So this one, do you think test is valid? No. This test is valid, and this is valid, but there is no infection or H. pylori. This is the H. pylori infection. So there are two bands. Clear?
Yes, ma'am.
Yes, ma'am.
Okay. So now pregnancy, like this H. pylori pregnancy tests are designed to detect minute accounts of what we measure here, HCG. What is the full name of HCG? Human chorionic gonadotropin hormone, which is secreted from where? We learned
Placenta.
yesterday. Placenta. That's why it only appears in high level when you are pregnant and when the placenta is formed. So it's a glycoprotein hormone secreted by the trophoblast of the developing embryo. Forget about that in the placenta. And it can rapidly increases in urine or serum during early stages of pregnancy. That is going to show you that you are pregnant. So you are going to get two bands if you are pregnant. If you get one band, that means you are not pregnant. If you have no bands, test kit is not working. I don't know whether I should do this one or not.
The earliest known pregnancy test dates back to 1350 BC in ancient Egypt. According to the Egyptians, all you have to do is urinate on wheat and barley seeds and wait. If either sprouts, congratulations, you're pregnant. And if wheat sprouts faster, it's a girl. But if barley, it's a boy. In 1963, a small study reproduced this test and found that it predicted pregnancy with a respectable 70% accuracy, though it couldn't reliably tell the sex of the baby. Scientists hypothesized that the test worked because pregnant women's urine contains more estrogen, which can promote seed growth. Now, it's easy to take this ancient method for granted because modern pregnancy tests give highly accurate results within minutes. So how do they work? Over-the-counter pregnancy tests are all designed to detect one thing, a hormone called HCG. HCG is produced in the earliest stages of pregnancy and starts a game of telephone that tells the body not to shed the inner lining of the uterus that month. As the pregnancy progresses, HCG supports the formation of the placenta, which transfers nutrients from mother to fetus. The test starts when urine is applied to the exposed end of the strip. As the fluid travels up the absorbent fibers, it will cross 3 separate zones, each with an important task. When the wave hits the first zone, the reaction zone, Y-shaped proteins called antibodies will grab onto any HCG. Attached to these antibodies is a handy enzyme with the ability to turn on dye molecules, which will be crucial later down the road. Then the urine picks up all the AB1 enzymes and carries them to the test zone, which is where the results show up. Secured to this zone are more Y-shaped antibodies that will also stick to HCG on one of its 5 binding sites. Scientists call this type of test a sandwich assay. If HCG is present, it gets sandwiched between the AB1 enzyme and AB2 and sticks to the test zone, allowing the attached dye-activating enzyme to do its job and create a visible pattern. If there's no HCG, the wave of urine and enzymes just passes on by. Finally, there's one last stop to make, the control zone. As in any good experiment, this step confirms that the test is working properly. Whether the AB1 enzymes never saw HCG or they're extras because Zone 1 is overstocked with them, all the unbound AB1 enzymes picked up in Zone 1 should end up here and activate more dye. So if no pattern appears, that indicates that the test was faulty. These tests are pretty reliable, but they're not fail-proof. For instance, false negatives can occur if concentrations of HCG aren't high enough for detection. After implantation, HCG levels double every 2 to 3 days, so it may just be too early to tell. And beverages can dilute the urine sample, which is why doctors recommend taking the test first thing in the morning. On the other hand, false positives can come from other sources of HCG, like IVF injections, ectopic pregnancies, or certain cancers such as uterine cancer or testicular cancer, making it possible for one of these tests to tell a man he's pregnant. The best way for a woman to find out for sure is at the doctor's office. The doctors are also looking for HCG, but with tests that are more sensitive and quantitative, which means they can determine the exact level of HCG in your blood. A few minutes can feel like forever when you're waiting on the results of a pregnancy test. But in that brief time, you're witnessing the power of the scientific method. That one little stick lets you ask a question, perform a controlled experiment, and then analyze the results to check your original hypothesis. And the best part is, you won't even have to wait until the next harvest.
They made it too complicated for you guys. Just the test window 1 and 2 is fine. Did this one, 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 pregnancy, rapid testing, pregnancy, this is the pregnancy, right? No, H. pylori, it's the pregnancy, So home urinary pregnancy is called the POC test, and in the same we do in the laboratory also using the testing. This is not the quantitative. This is the qualitative. Any test strip, what we use the qualitative, you can tell whether pregnant or not, but it cannot tell you how much or quantity is there. That only can do when you do the blood test or in the urine test to make the measurement, how much HCG is there, how many units are there. So that's why this is at the qualitative test. Many pregnancy test kits contain monoclonal antibody, MAB, direct against the beta subunit of the glycoprotein of the HCG. This is going to be the antigen, and which is going to be attached with the monoclonal antibody, which researcher has made to increase the specificity of the reaction. So beta human chorionic gonadotropin. This is the pregnancy hormone. For the first 6 to 8 weeks,
after conception. Beta HCG helps maintain the corpus luteum and stimulates the production of progesterone so that it's not going to shed out. You are not going to menstruate. Beta HCG is secreted 2 to 3 days after implantation, means when egg is fertilized and coming to the uterus, 8 to 10 days after conception of fertilization. In normal pregnancy, serum beta HCG values 25 mu m milli international unit IU per ml, and which is, even if you get this value, that means it indicates the pregnancy. It is getting higher as the days goes, and it stays the gestational week it up to 21, and then it slowly, when everything is done, then its placenta is formed, baby is getting okay, then slowly it's going to get down. Peak levels are reached approximately 2 to 3 months after the last menstrual period. This time the placenta is forming, baby needs the start to getting the placenta is going to be the mature, it's making safe for either it can do the transfer of nutrients and everything from the mother to baby. So levels rise rapidly after conception and it stays. So urine for beta HCG assay must be collected in a suitable time after fertilization to allow the concentration of the hormone to rise to a significant detectable level, usually detectable after 12 days. First, for beta HCG for pregnancy test, always better to do the first morning urine because first morning urine has the most concentrated one. Sometimes in the daytime you are drinking, peeing too much, so it's getting sometimes diluted. For any, not from the beta HCG, in generally for any type of urine test for the no, even analytes is present or not, morning urine is preferable. Is required because it contains the highest concentration of the hormone, and it should have a specific cavity at least 1.015, so that means it's a little bit dense. Specimens containing blood, large amounts of protein, or excessive bacterial contamination should not be used if you are, because it can interfere with the color. We already discussed this one. Control window, test window. False positive, we have already discussed. Some ectopic pregnancy, if you are getting the HCG injection for any reason, any trophoblastic kind of any kind of cancer, in the ovarian cancer or uterine cancer, mainly the uterine cancer, can give you the false positive result. Sometimes who has the cyst in the uterus, sometimes give the false positive results. So test result should be reported as beta HCG positive or beta HCG negative, not as pregnancy positive or pregnancy negative, because you doesn't know the positiveness is that due to pregnancy or for non-pregnancy. For doing that one, you have to do further testing. False negative, too early to detect HCG levels. Test again in another 48 to 72 hours. If you think you are pregnant, immediately with excitement, you do the test, but it takes some time to get the, and it depends upon the person to person. So, okay, don't get depressed. If you think you may be pregnant, you can test again after 48 to 72 hours. Sometimes collect again the morning urine, not the daytime urine. Confirmatory test quantitative serum HCG immunoassay testing on an analyzer. So ultimately, if you think that, you have to go to the doctor's office and you have to do the quantitative assessment of your beta HCG hormone, which can be drawn in the serum. You are going to do the test. So you have kit storage stability instruction, specimen collection and storage instruction, quality control, test procedure, limitation. In the product insert, you are going to get everything. You are going to do the test for the, when you are going to, and yeah, good. We have one pregnant lady in the class. So maybe if we have one, so maybe we can just get the pregnancy positive or negative. You guys can see it. So non-instrument strip-based is another is fecal test. Fecal occult blood test. It use the detection of occult blood in feces is important. If there is hypochromic anemia, that means loss of blood, chronic loss of blood in detecting sometimes ulcer due to ulcer, some neoplastic disease, some gastrointestinal hemorrhage or anything. So if there is any blood is coming out in your digestive system and then is going to the blood, to catch that one, you have to use the fecal occult blood testing. We call FOBT in short, FOBT. Blood in the feces may result from bleeding anywhere along the GI tract, from mouth to the anus. So test for occult blood tests are specially used for the screening, not for quantitative. Again, it's a qualitative for early detection of treatment of colorectal cancer. Because more than half of all cancer, exclude the skin, are from the GI tract. Early detection results good survival. So there are three types of FOBT test in chemistry. FOBT, fecal immunochromatography, case FIT, and stool deoxyribonucleic acid is called the sDNA. Bleeding in GI system, any point, as little as 2 ml of blood loss daily may be detected by the test for occult blood, any of the test. Okay, so FOB test. Purpose of the test is screen for colon cancer. So POCT, blood for FOB test, is the screen for colon cancer. Okay. Occult. What does mean occult? Occult. Why is called occult? Occult means hidden. Very small level of blood is not maybe noticeable by your own eye, but this test can catch it. Small patient collected samples of stool are put on a special cart and sent to the lab where the chemicals are applied on the backside of the specimen card to check the results. If blood is present, there will be color change. With some test kits, the chemicals can be added by the individual at the home, but generally it has to be sent to the lab. FOBT test kits are low cost and should be done every year after age of 50. Generally, if you give some complaint, doctors do that. So this card is going to come like this. They are going to 3 days. There will be instruction. You are going to write the name, all the details of the date of collection, time of collection, and then you have to collect the samples in 3 days. There will be 2 windows, and then you are going to send it to the lab, and lab is going to do the test. This is a color development. For chemical testing, a solution containing the chemical guaic as it is used. This is, you have to remember, sometimes it comes the question. Which solution is used for the FOBT testing for the color development? Guaic. See, blood is present in the sample of the stool. The mixing of the solution with blood causes guaic to turn visibly blue. So you have your stool sample in the card. If you put the guaic, it turns blue. That means there is a presence of blood or hemoglobin. Sometimes it's cast in the terms of hemoglobin because hemoglobin is one of the constitution of blood. Blue color is caused by the interaction of the heme protein. Here you comes, heme protein of the hemoglobin molecule, which is the oxygen carrying capacity of the molecule in red blood cells. Sometimes in the question, they may give you the blood. Why FOB test using? It can to detect the hemoglobin. If the option is the hemoglobin, you have to take the hemoglobin because hemoglobin is the major part of the blood and actually it is detecting the heme molecule, heme portion of the hemoglobin molecule for the FOB test. So how it looks like. Hemoglobin, you have the guaic, so it's going to ultimately change the color to blue. And there is a always control and test window. What are the limitations? Unlike heme, which can travel interact from stomach to small intestine into the stool, sometimes globin is destroyed in the small intestine. As a result, positive chemical apophity can be caused by bleeding anywhere in the stomach or intestine, but a positive immunologic apophity only occurs there is a bleeding into the colon. So what is telling? Maybe it is traveling, is going to be a stomach up. By the time when it's reaching, maybe it can be destroyed, the globin part. So it's more, but the colon is very close. So there will be less chance of the destruction. So that is very useful for detecting the colorectal cancer or colon cancer. Purpose of test to screen colon cancer. Again, another test, FIT. Still looking for fecal occult blood. Patient collected sample is sent to the lab from patient collections, uses immunoassay testing rather than chemical or color change. The same thing, different labs use the different immunoassay, means it's going to the again antigen antibody complex. A sample of stool mixed with a solution, how it goes, contains with an antibody to globin. Globin is the protein which is present on the cell, and this antibody is against in the globin protein. So it's going to interact the protein part of the hemoglobin molecule, which is the globin. So ultimately, I am not going to deal with the sandwich or how the mechanism is not going to lead. Ultimately, it's kind of the test window. So like the test strip, so it's going to be like that you did for the pregnancy or other things. So when you are going to say give the solution which contains the antibody is going to come as a visible line on the test strip. So this is the thing, immunological testing. You have the test window, control window, you have to write everything, and ultimately you are going to put a solution. It is going to migrate, and if there is any blood present, it is going to give you some colors. So it is more sensitive for blood. It can detect blood in smaller quantity than ApoB. That's why this is more sensitive. It detects cancer and precancerous polyps more frequently than ApoB. If there is a precancerous polyp which may lead to the cancer, it is more specific for blood testing. Okay. Now, there are a couple of things you are going to know about the ApoB. What are the limitations? Where you can do the false result. False negatives could be due to inhibitors in samples, but false positives need to restrict some diet before you do the false positive, probably for 3 days, if I remember correctly. You cannot eat red meat, which contains hemoglobin, which can cause a false positive test. Substances in fruits and vegetables can mimic peroxidase activity, like the broccoli, turnip, horseradish, banana. Cook before eating so that the enzyme, which is active enzyme, can be destroyed. White blood cells and bacteria also have peroxidase activity that might result in the false positive reactions. So if you have infection, if you have cold, if you have flu, if there is a chance of increase of the WBC count in your body, so that time you try to avoid collecting the samples. Some drugs needs to be stopped before and during collection. What is that? Vitamin C, ascorbic acid, some aspirin, who are in anticoagulant therapy for doing the ApoB test, they have to stop for 3 days, if I remember correctly. Implications of both false positive and false negative tests are important clinically. Early diagnosis and treatment of serious disease might be missed with false negative result, resulting in poor prognosis and health. So be careful. You are not doing anything which can give the false negative result. And what is the sDNA? This is the molecular testing. This is not a point of care testing because DNA, it has to go to the lab. We cannot do extract or anything in the DNA. Rather than looking for the blood in the stool, the sDNA test looks for abnormal DNA from cancer or polyp cells. They are going to collect the polyp cells and then they are going to do the test. Of these three fecal tests, sDNA costs the most and should be done every 5 years after age 50. Nobody does that. The OHIP doesn't do that. So handle POC instrument, microprocessor that the instrument based now. Those are the test non-instrument. It's a small and often handheld instrument, provide automated, easy to perform testing with calibration and board on QC. The glucometer, HemaQ, these are handheld POC instruments. So most instruments are use small quantities of whole blood placed directly in your testing well or chamber. Okay, like you did for the glucose test tube or you did the HemaQ. Storage at ambient temperature for reagents, whether it's a room temperature or in the refrigerator as per your guidelines, SOP, what is called as per your HUMS guideline, SDS, barcode technology for test packs, control specimens, everything. This is economical equipment cost and maintenance free. Software for automatic calibration, system lockouts, data management, hard copy of electronic data output that interface with the LIC or other tracking system. You doesn't need to know so much. Just let us go where you know. Handle or small analyzer are frequently located in the intensive care unit, in the emergency or surgery for quick results to help guide treatment. Measurement can include the following: electrolytes, sodium, potassium, calcium, magnesium, prothrombin time, partial, PTT, activated clotting time, hematocrit, you guys did it, arterial blood gas, we doesn't do it, nurses can do it, urea, glucose, hemoglobin. These all type of test can be done with some small handheld point care testing instrument. But rarely we use even in the lab. I don't know about the ICU or the OT. I never worked there, but in the emergency, we just mainly use the glucose. That's all. We don't do anything else. It's going to be because in the ED we can get the results within 30 minutes for anything. So handle POC instrument are small, use a small amount of blood specimen, require minimal routine and preventive maintenance, and automate or eliminate calibration function is automated, right? This type of automation requires minimal technical support and is relatively maintenance free and easy to use. Depends upon what type of analyzer you are using. But most of the POCT instruments can be linked to laboratory information system. Nowadays, they have improved. So they can, you can use the, transfer the USB and other things, and you can transfer the data directly to the LIS. Output data is visibly displayed and then stored in the unit to transfer to the LIS. So what are the advantages? Small blood sample, rapid turnaround time, easy portability with single-use disposable reagent cartridge or test strips, easy to perform protocol with 1 or 2 steps, accuracy and precision of result comparable with central laboratory analyzer. So, and minimal QC tracking. Disadvantage: cost per toss, more expensive than lab testing for every or POCT, and degree of maintenance. Testing error from improper cleaning of specimen and devices between the patient and also not doing the routine cleaning. Used by untrained individuals can affect results. My dentist is calling. I'll take the call later. I didn't book for a long time. Nice. So now the benchtop analyzer. Those are the small instrument. Even its benchtop is still smaller than the clinical lab analyzer, which are huge, especially nowadays the auto analyzer. It can be found in hospital wards where they need to do it immediate, emergency room departments, but doctor's office and clinical labs. Doctor's office mainly use that lot. Smaller and cheaper than full analyzer, more complex as calibration, quality control, and regularly scheduled maintenance is required to ensure analyzer is working well. You have to be regularly do the maintenance, make sure whether it's going to be the quality control is dying, quality assurance, quality management. Is that analyzer is working properly? Okay. It can be linked to the LIS if it is have the option. More trading, non-lab stuff is running test on it is better to run who has the knowledge. Non-lab stuff is need to be properly trained if they have to run it. Excellent options for smaller labs in rural and remote location for sure. We have urine analysis analyzer. It's called a dipstick analyzer. You can do the dipstick by visual seeing, comparing with the colors. It gives the urine analysis strip bottle, or you can put it in the analyzer. Can connect to LIS even wireless now. Nowadays, we don't in the lab we doesn't have that one, but nowadays it has been improved and they have the dipstick analyzer which can be linked directly to the LIS. Has operator ID entry and lockout. This stops untrained people from testing. So you have to scan your operator ID. So you are trained. So it is going to be already something, some barcode or something has there. So you have to scan it so that it knows that who is doing that. QC lockout if protocol is not followed for QC test fails. So nowadays is so beautiful. So if you doesn't did the QC or the QC fails, it's going to locked out. You will not allow you to do the test until you do the QC properly. QC documentation and report downloads available on demand. Auto check strips per humidity, whether it should be put with the silica gel in a dry condition. It should not be open, leave open for a long time where there is a humidity. Detects interference if the test samples and provides printed notation for result interpretation. Can test for multiple assays. So these are the, you are going to see one of these analyzer. So you are going to, now we don't have the scanner to do the scan. Who is doing that? This is the scanner to make sure who is doing that. We don't have the scanner, but you can put urine on the test strip, dip it, and then you can put it inside the analyzer. It is going to give you the results. Sometimes we compare the results with the analyzer versus you do the estimation from the test strip color. We can also, there is some other tests which you can do, COVID-19, you can do the influenza, you can RSV, everything you can do the molecular testing. It's not going PEC. This is created for reference lab, can also run testing for COVID, influenza, RSV. Instead, in addition to the rapid tests, you can do the molecular testing using the POCT analyzer. This is, we don't have this one. Maybe you can, when you will go to different labs, you can see it. This is the called the benchtop POCT analyzer. So this is very important why the POCT is needed for remote or rural location. Thus, blood has to be sieved to get disadvantages for testing. What will be the cost for the analyzer and per test? What is the cost of implementation? What does the training entail? Will it improve healthcare accessibility for the patient population, diagnosis and treatment? But for sure, it is very helpful for the remote or rural location, and when there you need the test, which what turnaround time is very less. That means you need the fast, immediate result. That is very useful, the POCT testing. Benchtop POCT gone wrong. Notice Theranos, a company founded by that the device, a handheld instrument called the Edison for the Minilab, they claimed could diagnose 240 different diseases from a drop of blood faster, more accurately, and for less money than exciting. Was the video. Okay. Let us watch the video. What they say.
Most people have no clue that in 2023, the best way to make money on Amazon is not with physical products. It's Amazon's other company, Audible. Audible pays me $8,000 to $10,000 every single month in passive income, and I'm not the only one. People like Katrina and Carla, Elena, Renee, all.
Biotech company Theranos promised a blood testing revolution. With just a single drop of blood, their machine could run hundreds of medical tests. Except the technology didn't exist. At least, not in the way that its founder, Elizabeth Holmes, envisioned it. But that dream isn't over yet. Theranos made some pretty lofty promises that would have upended traditional blood testing as we knew it, with its mini-lab dubbed the Edison.
If you could have just a single drop of blood, you wouldn't need to go to a lab and get your blood drawn for testing. It would make it so much easier. Really revolutionize the blood testing industry. Like, that's a appealing promise.
Nicole Wetzman is a health reporter at The Verge. She's spent time covering the Theranos trial from the courthouse in San Jose and explained to us why the blood testing industry even needed a company like Theranos to begin with.
For a standard blood test, you have to go sit down and a lab tech will draw vials of blood out of your arm, and then it gets sent out to a lab, or some larger offices might have machines in-house. So Theranos claimed to be able to create a system that would kind of circumvent a lot of those challenges. So they said that they could have a tabletop doctor's office sized machine that could run hundreds of blood tests on a single drop of blood.
But even from the beginning, pathologists questioned the accuracy.
What I'm surprised about is, you look at the people in the room, and there's clearly been a lot of interest in your company. I would argue that a lot of that comes from the fact that there were these claims that were made that were very broad early on. 70 tests, the whole, panoply of lab tests from a couple drops of blood. And the evidence that you presented fell far short of that.
There are things that you can do with a single drop of blood. You can test your blood sugar level, for example. But there are other things where a single drop is just not realistic. There might not be a high enough concentration of what you're trying to measure in a tiny drop.
Studies have shown that important blood markers, such as white blood cell count or hemoglobin, can vary greatly from one drop to another when obtained via the finger.
Right.
But even if individual drops were identical, certain tests need to separate out cells with a centrifuge or add specific chemicals to the samples that would make repeat testing impossible. Theranos' ambitions are commendable, but the idea was nothing new.
So there are things that Theranos was trying to do that are also things that more realistic researchers are also working on. You kind of have a couple of main things happening. You have the single drop of blood issue, you have the lots of tests on one sample issue, and you have the let's shrink this all down to a small machine. And those all kind of individually are things that people are working on. But those are really hard, and there are a lot of kind of really significant challenges that a lot of smart people are working on. Experts do not really think that that sort of pie in the sky vision is something that's really going to be feasible, despite kind of the potential for a lot of this stuff to really be improved and innovated on in reality.
While many researchers had been trying to advance this technology in labs, a ton of buzz surrounded Theranos because it was telling investors it could all be done right now. According to testimony from the trial, Holmes was telling investors that the machines were already being used on military helicopters in combat zones. These claims would not only come back to haunt Elizabeth Holmes in her fraud trial, but they also had a chilling effect on other research being conducted in the field of blood testing.
Folks who are working on blood testing technology and trying to shrink down tests or do more with less had trouble getting funding or interest because investors said, well, Theranos has already done this, so why should we invest with you? And then when it came out that Theranos couldn't actually do what they said they were going to do, you had sort of the opposite problem where people would say, oh, but isn't that all just a scam? And so that made it harder for people to attract funding for their more realistic projects.
As we approach the end of the trial of Elizabeth Holmes, it's become clear that this trial has uncovered many cracks in the way that startups operate, particularly healthcare startups.
The Theranos scandal and fallout has really made people kind of question whether the Silicon Valley startup move fast, break things ethos is the approach we should be taking to medical technology, where people's health and lives are sort of really on the line here, and the accuracy and success of these technologies has really important implications for people's health.
And because of this, everyone will remain highly skeptical of any new advancements in the blood testing industry for years to come.
Like anything in science and medical technology, you're going to see progress and you're going to see kind of iterative innovation. But what we're likely not going to see is someone pop out of the ground with a device that's going to change everything. You know, science is hard, and we want to be careful with how we move forward and make sure that the progress we're making is actually real progress.
It is scary, dear.
Yes, ma'am. There was a lot of controversy about the Theranos.
I don't
all
agree
over.
with that one. I don't agree with that. And moreover, you can see what is the thing? We are going to lose our jobs.
Yes. Yeah.
Okay.
They even say that she's a girl, but her voice is a man.
Yeah.
Husky. Yeah.
And I don't believe that. I don't trust on that, because it's not possible for a one drop of blood. How you are going to? It says the one drop of blood to second drop of blood, it can change a lot of things. Oh my God.
Yeah. Big controversy on Theranos.
So now you have some time, 12 within 30 minutes, in groups of 3 or 4, research a POCT that would be beneficial to your community. You can make 5, I don't mind. 5 in a group, make it, because you are 20 in groups. Don't make anything. I am taking this one, and they make 5 people in a group and search about some POCT that would be beneficial to your community health clinic. These are the different manufacturers. Pick one of the POCT device that would be beneficial to the clinic. Do some preliminary research on the device, asking yourself the following: is it user friendly? What is the training? What is the quality control process? Is there any estimate cost per device and per test? Why would this be useful compared to sending the samples to the lab for testing? Create a 5 minutes informal presentation. Choose one person in your group to present, all groups to be present in the class. So you can do right now. What do you want to do in the Wednesday? It's up to you guys, but you have to do that. That is a part of your curriculum. You guys want to make a group and do that?
Why do they hate us?
Are we going to submit that also, ma'am?
You have to do the oral presentation. It's going to be then Wednesday. You have to do all the oral presentation. You see, here only one person can present. You can make 4 groups out of 20. At least one person is going to present this one, but that one has to be present each one. The other one, the assignment.
Okay, so can we do the presentation and everything for the first assignment Wednesday, and then the second one, can we do it Thursday morning? Because it is only a short one with one person reading.
But whether we are going to get the rooms, because Badal wants to use the room, we'll see. Otherwise, we'll do it in our PowerPoint, in our class
Okay.
PowerPoint. Otherwise, we can do it our class PowerPoint. Okay. So do that one. You guys can make the groups, and I don't like to see. I have 4 people. I have 6 people. You have 20 people. So you have to divide it equally 5, 5, 5. Okay. Do the teamwork. I am leaving you guys to choose your groups. Or otherwise, I'll go random and ask. Whatever you guys want. I will just say, okay, this 5, this
Miss,
5, this 5. Yes.
Maybe is it our cleaning groups are okay, or do you want us to make groups?
I have no idea. Like last time you did the cleaning groups, I saw 1 people 3, another 6, another 5. I don't mind. Whatever. I need 5 people in a group for this one.
Okay.
Okay, ma'am.
Thank you.
Okay. So you guys are going to work on this, and we are going to do it on the Wednesday. Okay. I extended the time till Wednesday for this one. Okay. It's going to be 5 minutes formal presentation. What type of question you have for me?
Yeah, I'm going to ask again, ma'am, are we going to have a submission also on this assignment?
No, you doesn't need to submit. Only you do the presentation. But
Okay,
submit it on so that if we have to do my computer there, okay,
yes.
then you don't have to do your things, or you have to bring the USB, or if you submit it there in my email Outlook, so it is going to be easy to open the email and do the presentation.
Yeah, okay, ma'am. Thank you.
Okay, so you can just write everything on the PowerPoint, whatever you're going to make for 5 minutes presentation for this one. 5 people's name in the PowerPoint. You have to write down the whatever the assignment is. Okay, what type of POCT device you have chosen, and then the names, who is going to do that, and who is going to be the presenter. In the first slide, did everybody understand that? What I say?
Yes, ma'am.
So in the first slide, you are going to do this is for POCT testing assignment. Next, the device you have chosen, name of the device. Next, who is in the group, the name of the groups. Okay, 5 people's name and presenter names. Who is going to present that one? You guys can decide who is going to present. Don't fight. Everyone has to do the presentation. Okay, and then you are going to use the other PowerPoints, not too long, max 5 minutes. Okay, so what are the things they told? You have to mention all those things. What are the questions they ask? Is the user friendly? What is the training? What is the quality control process? Estimated cost per device per test? Why would this be useful? So each PowerPoint, 1, 2, 3, 4, 5. There will be 5 slides in addition to the introduction slide. Okay. So on maximum 6 slides. 5, 6, the introduction, maximum 7 slides. So you are going to, each one you are going to do, is it user friendly? Then that PowerPoint is going to tell you that thing. What is the training? Next PowerPoint is going to tell you that one. Okay. So each point has to be discussed, and you can do it in 5 groups. So what is easy? So, okay, you choose your group, choose your device, and then each one can take one. Okay, I am going to check on the user friendly. You can check on the training. You can, so it's going to take short time, and then you all can put in one presentation. But it's up to you guys how you want to do that. Okay.
Okay, ma'am. Thank you.
Is it clear to everyone? Any question? You didn't understand anything, or I have to read it? I am telling you, if I don't see in the slide, the name, no name is there, whatever I said, say nobody is going to do the presentation and the marks will be 0. Now you are end of, I am telling you, you are end of your course. So you have to be very attentive, you particular, follow all the rules and regulations. That is the test, how you are more attentive and follow all the things with attention details. Okay, so please take care of that, and you guys can do some reviews now. Okay, That's why I give you some time. It's 1 hour. Do your reviews for this final exam. No response.
Ma'am, we received an email from you regarding GR and MLH ending September 2024, but there was no content on that.
I don't know. It's not my email, dear. Somebody has give it to me, and I have sent it to them.
Oh, okay, ma'am.
It's not me. Badil sent us some email, and he told me to forward to you, so I did that.
Okay, thank you.
Okay.
We'll check it in Outlook then.
Yeah. Okay, you guys start doing some review right now. Okay, so 1 hour till now. Okay, so I don't need to share any presentation right now. I'm sharing, stop sharing, but till I am on microphone. So how you guys want to do the review? You guys said something for the final one. Who is going to be the leader today?
Oh, do we have the copy, ma'am?
What copy?
For the review? Final exam?
No, I didn't able to make it till now. I told you guys. So you start doing some review.
Oh, yeah.
Whatever you think, you guys start doing that. By that time, I will try to do something. I'll send it. I'll try. I worked whole night yesterday for you guys. My goodness.
Yeah, thank you. Appreciate
But
that.
till now, I didn't finish it. Christian is laughing, smiling, not laughing, smiling, listening that. It's good. Moon is working overnight. Very good. Right, Christian?
No, miss.
Thank you,
It's too
miss.
much for you, but thank you.
Thank you.
Thank you, ma'am. It won't take long, ma'am. 2 more months. Thank you.
And then? Then you are ready to leave me, right?
No,
then
miss.
we're
No,
going
we're
to
not.
treat you big time.
Moon is too boring for us. Too much pressure, right?
Miss,
Actually, then we
miss,
will.
you don't know how important you are to us, honestly. And this is like you honestly, I'm telling you that we do appreciate what you're doing.
Yes. Yes, miss. We
Honestly.
do.
I love you guys. This is my
I love you
dedication.
too,
I
ma'am.
love
Thank
teaching.
you.
We love you too, miss.
Yeah.
Thank you.
It's not like what I got paid in the hospital. I just far less paid here. So every time my husband is telling why you are doing the 2 jobs, you doesn't have to. This is my passion. I like to teach. I like to. It's
Yeah.
almost I'm going to end my career probably for some years. But when I'll see whom I teach, they are, the Fridays, they are becoming good professional. That is my satisfaction. That I left something what I know among the people, among the medical healthcare professionals.
Yeah.
Yeah.
You know, Miss
Sometimes it's
Momo.
too much, so that's why they all. Why you have to do that? Yeah, they
You know
tells me.
what? You know what, Miss Mumam, you're doing good, and honestly, it's not stop here. It just begin because I'm going to tell you why. This week I have the opportunity to one of my teacher from grade school visited me at my house with my best friend. My best friend is her daughter, and she came from grade school. From grade school, like yeah.
Wow.
Yeah, so we keep
It's a
in
so
touch.
thrilling moment.
So,
Yeah.
yeah, it was very good, very good, very good. So way back.
I
So
know it's good to hear, Asnet, but so far, when the students become involved in their profession, rarely they send an email or message or anything to me until and unless they need some recommendation or something. They even say hi or something. Sometimes I send them the message, but they doesn't. That is the very sad part from a teacher. But I become used to it now.
yeah. They get busy after, right?
Yeah. Anyway,
Yeah.
you guys start doing your what is called review. I am going to finish the review things and I'm going to send this as soon as I can. Okay, so that you guys can work on that. Okay. the
Okay,
final.
ma'am. Yeah,
Okay,
thank
I
you.
don't like to waste your
I
time.
just
Yeah, yeah,
I just have a
yeah.
question is how do we know which group then? Because that we're in, like are we gonna individually making the group how because last time I remember 2 people got left out. And we don't want that to
I
happen
was
again.
just
You
gonna
you you
say,
you, you want me to make a group?
Mom, we already have a group. As in it, our group is the same. We have to add.
yes,
Yes.
We have to
As
add
not
Asna, check the
Benash.
chat.
I also
Oh,
have a
okay.
group already. So I mean,
Yeah.
we also have a group. So yeah, but in
Check
our
the
group,
chat.
we wanted to ask Kara if she wanted to join our group.
And Binas, which group you are working? Binas is new.
As
Ask
not
her.
Evelyn. Yeah,
Huh?
we are
Benash
have
is
group.
with us. Evelyn
Yeah, Evelyn,
Benash.
Veena, Sneda, Snap.
Kara, would you do you want to be in our group? It's me, Santiago, Alexia, Luis,
No,
and
Shabana.
Huda.
They already have a group.
Yeah, 4 people, right? So you're saying we can add 1 more person.
We are
No,
all 20 guys. Each group
So
have
it'd be
5
5
members.
groups. How many people are we gonna have per group?
5 members.
5 for
5,
this
right?
presentation. For this presentation, but for the
Yes.
assignment, 2 people per
Yes,
group.
Assignment is 2 people, and then for the group project is 5 people.
Right.
Yeah.
Okay.
So I don't like to hear that 6 people in one group and the
Yep.
4 people in another group. I need equal distribution. If you want to do it, fine. If you doesn't, I will make the group and send it to you guys. But I'm going to pick the random.
So
Okay.
Verna, you said that we already have a group.
Yes, as in it. We
Yes.
just include
good.
Benash in our group so that we
Okay.
have 5
Okay.
members.
Okay, that sounds good.
Yeah.
Thank you. Thank you.
Ma'am, it's already on the chat. Our group is on the chat.
So Amina, Christiana, Chris, Maris, and Joanna. Okay. What is the Evelyn? I didn't get your message. I saw only one.
It's on top, ma'am.
It's on the Mom, on the
Amina,
top.
Fazardo, Chris, Maris, and Joanna.
On the top, Mom. Evelyn, Verna,
Oh, okay,
Zenaida,
okay, on the top.
Astrid, and
Evelyn, okay, on the top. Okay, so it's going far. Okay.
Um,
Amina, Christian, Fazardo, Yusra, Kara, Inghong, Joanna. Joanna is in 2 group. How come?
Joanna just switched. So I think I'm taking
sorry,
Huda.
madam.
Yeah,
switched
we
to
have
Serena May.
Kara, Huda, Luis.
Okay, guys, don't send it until it's fixed. It's going to be confuse me.
Okay.
When it's fixed, then send the group. Okay.
Okay. Thank you.
Okay. 1% write in email about the groups and send it to my email. Okay. 1% take the lead, the group. Okay. Group 1, group 2, group 3, group 4, 5, and then you just put the names under the group 1. 1% can send, not everybody send me, just 1% take the lead and send for the POCT group projects. These are the groups. Okay. Group 1, group 2, and each 5 names. Otherwise, it's getting, and what is your topic? You can write it to me or you can present it in the presentation. Okay. Okay. It's getting confused to me because I'm seeing Joanna here, Joanna there. Now how I'm going to miss. Okay. So you guys can work on your review. Let me see how I can help you for the clinical one.
Okay, thank you, Miss.
Okay. No problem, sweethearts. I forgot to tell you one thing. So that time, yeah. So what are the common tests for the blood alcohol? Is mainly testing the ethanol and methanol. Okay. That is the blood alcohol testing.
Hello there. Hi guys.
Yes. What? Who is talking to me? Will you have to
Sorry,
join our
mom.
class? Will you have to join
Yes.
my class? Come on.
What's up, mom? Sorry.
It's okay. It's okay. It's okay. Okay.
Hi, I just wanted to confirm something. So my group, Kara, Yusra, Yung Hong, and Hoda, right?
Yes.
I don't know
Okay.
which group I'm in now.
Yeah,
What?
you're in our group. So it's Kara, Yusra, Yung Hong, and Hoda, and then me.
Yes.
Oh, thank you. Thank you so
Okay.
much.
No problem.
Perfect.
Thank you. And then I think we have two more groups. So it's Evelyn, Verna, Zenaida, Asnet, and Binesh.
Yes. You are right, Christiana. Thank you.
Okay. Then the third group is Amina, Zermaine.
group two.
Oh, sorry. So Amina, Zermaine, Chris, Maurice, and Joanna.
It's
Okay.
hard to talk.
Yes, that's our group, Christy. Yes, that's our group,
That's your
confirm.
group. Okay.
Yeah.
So there's one more group missing. And then we can email it to Miss Moon Moon.
Hi guys. I just wanted to I think we have 4 people in our group. Is there anybody missing a group by any chance? Does everybody have a group?
Shabana, what's your group?
It's myself, Alexia, Santiago, Lewis, and I thought we had Huda, but Huda's already, I believe she's in Kara's group,
understand.
right? So is there somebody missing
Oh, yes,
that doesn't have a
Regatu.
group? Okay, we can take Regato, no problem,
Okay.
if she doesn't have a group.
Kara, I guess I'm back in your group. I'm
We
sorry.
have to select one to each person. Yeah, there's a 5.
Okay, then we're done. All the groups are
Yeah,
done
that's
now.
fine. We've got all ours.
Yep.
Yeah.
Okay.
Let's
Does somebody want to make the list and email it to Miss Moon Moon?
Sure.
Okay.
I can do it.
Her.
Thank you.
Oh, Lugiatu doesn't have group now.
Yes, we confirmed Regatu is in group 4 with Shabana and Santiago. So that's it. We're all set. Thank you, Yung Hong.
Let's leave first, guys, and then after class we can talk about it.
Okay. Thank you.
Let's do our own research.
Hello? Hello, group?
Hello,
Hello?
ma'am.
Yes,
Hello,
ma'am.
ma'am.
Can
Yes,
you hear
ma'am,
me?
miss.
Yes,
We
yes,
can
we
hear
can
you.
hear you, ma'am.
Did you get anything?
Yes,
I got an
ma'am. Thank you
email.
so much.
Yes, ma'am. Thank you.
Okay. So now
We're
work in
very
the group.
happy. Yes,
Okay.
ma'am.
Okay, ma'am.
I try to do my best. I don't know, but I try to do my best. Okay.
Thank you,
Okay.
Thank you,
ma'am. We
ma'am. We
appreciate
appreciate
it.
it.
Now you have till time
Thank you,
to do that
miss.
one. You can extend a little bit time and complete your reviews. Okay. Okay. Or you
Okay,
can meet
ma'am.
any time if whatever you want. My job is
Thank you,
done.
ma'am.
Thank you,
miss.
miss. You did a great job.
Mm-hmm. Thank you. I try. I cannot promise, but I try. Mm-mm-mm-mm-mm-mm.
Yes, honey.
I got up to group 4. There is 4 groups, right? Okay, good. Thank you. Thanks a lot.
No problem, miss.
Thank you. Thank you. Kara Yusra. Kara Yusra. Ingong, did you get your answer for your question? Ingong?
Hi, miss.
Did you got my email regarding your answer questions regarding your math?
Oh, yes, mom. I appreciate it. Yes, I got
Okay,
it.
thank you. Okay, thank you. Okay.
Thank you. Thank you,
Okay,
mom.
no problem, no problem. So in group Aminia, Christiana, Chris, Maris, Joanna. Okay. No, it's not Christiana.
No, that's Serena.
Is that Fazardo?
Yes, mom.
Okay. Okay. Chris. Fazardo and Chris are always in same group. And Maris, okay. Maris and Joanna. Joanna, okay. Group 4. 1, 2, 3, 4, 5, 6, 7. I need the group 4, 5. Okay, delete. Okay, group 4 is Shabana.
I got 4 names in the last one. What? Oh, Luis. Okay, Santiago and Luis. Okay. Savannah, Alexia, Rugiato, Rugiato, Luis, and Santiago. Santiago and Luis. It is going to help me to mark. Okay, so good. I don't need this one. No fill. No fill. Okay, so group this one done.
you.